Good morning. It's a great pleasure to be here, and I'm quite honored that, in fact, this is the third of this meeting I'm attending. The first one was in Delhi, I believe in 2010. Last year I was in Hyderabad, and this time I am in my hometown, Kolkata. Of course, I've come from Delhi now. So I'll just give a brief overview about where we are, what are we trying to do with the portal, and more importantly, it is actually at the intersections of various interesting activities which are likely to happen over the next few months. So essentially, the National Health Portal is an offshoot of a recommendation from the National Knowledge Commission, and it is aiming to be the first point of access for any information related to health. So the goal is for it to become the gateway to authentic information for all. I mean, authentic health information, that's a key word. Single point access, of course, initially it is being planned as an informational portal, but gradually it is likely to become also a transactional portal. And like we are all aware, we have just heard of the recently launched Pradhan Mantri, that Jan Dhan Yojana. So it's something like that where every person and 1.27 billion of the population of India, everyone should have access to the right healthcare information. So this we are doing through collection, verification and dissemination of health and healthcare delivery services related information. Yes, we are very much there in the social media. We also have interactive forums within the portal. So there's a general forum for discussion among anyone. There's a professional forum where professionals are expected to discuss, interact, discuss maybe cases also in a de-identified manner. Another activity which I believe will be covered again in this workshop over this time, over today and tomorrow. The Government of India, Ministry of Health has actually put up the guidelines for following some standards for the implementation of electronic health records. And this has been notified last September. So at the National Health Portal, we have set up a help desk for that, where we have some resources. Also, we have a discussion forum. We are very much there on the Facebook. We have a page, National Health Portal of India, and we are also there on the Twitter. That's NHP_India. This is the roadmap. Now, Mr. Suresh Kuchatil is also here. He's one of the co-authors of the detailed project report. In fact, I am also one of the co-authors of the detailed project report, which was formed for forming this National Health Portal, and this is essentially from there. Mr. Kuchatil is also the member of the steering committee of the National Health Portal. So in the first year, we are supposed to just collect and collate health information from the different sources. And of course, we have to put it on the web and use other means, print, TV, radio, as well as we are also thinking of, because although we are talking about India and the internet penetration, but it's still far from ideal. We still have a lot of people not covered by the internet, but they are having phones. So phone-based services also will very soon be launched. And then, of course, we'll be having the information available in all the languages possible. Right now, we have 5 translators in our team. So we are going to have, other than English and Hindi, also in Gujarati, Tamil, and Bangla. And of course, Punjabi is likely to be there as well. Then we are building some interactive modules, e-learning. All those various activities are in the pipeline. The portal has actually been live for beta testing since November 2013. So it's been now almost 9 months. And it will be formally launched hopefully by the end of this month. So this is how it looks like. Of course, now the screens become like that. When you take a screenshot, it doesn't really do justice. And when you take the screenshot and then put it on the PowerPoint slide, then the aspect ratio goes for another turn. So you really don't, it doesn't really look that bad as it's looking here on the screen. But if you can just go and see, so those of you who are online, you can just check It's nhp.gov.in, National Health Portal. It's a government site. So nhp.gov.in, you can just go through it, you can navigate, you can give your comments, feedback. Of course, it will be great if you register and you can then take part in the forum discussions as well. So these are our tweets and Facebook feeds. Now, this is the most important slide on which I would like to spend some time. Like I said, the National Health Portal is a recommendation of the National Knowledge Commission. The National Knowledge Commission also had recommended the formation of a National Health Information Authority. That was way back in 2008. 6 years have passed. We are still not there. Fortunately enough, the current government, in fact, the ruling party in its election manifesto had included this agenda item. And so it has actually got a cabinet clearance, and now the process is on. Of course, the name is slightly changed. It's likely to be the National E-Health Authority of India. It is being set up. Right now, we are in the process of preparing a concept note for it, which would be uploaded, the draft will be uploaded for comments from all, probably by the beginning of next month, that is October. So that would be there for comments from all for a couple of months. And likewise, the process would be on, so finally it would be put as a cabinet note, and which is likely to go the legislation way. So a formal authority will be set up. Once the authority is set up, the National Health Portal will certainly be a part of it. We have another action going on. There's a mission mode project in the National E-Governance Plan. So there are mission mode projects for various activities. Health is one of them. In that mission mode project for health, there is a proposal for a transactional and transformational citizens portal, which can be built upon the National Health Portal. So that again is one thing which is likely to converge. Dr. Karanveer Singh is here. He has attended the meeting that we had with IHT-SDO, the Standards Developing Organization for SNOMED City. In fact, India has become a licensee, a national licensee, or a country member of the IHT-SDO since April. So it is, as you're all aware, those who are working in that field in medical vocabulary. Now, one of the conditions to become a national member is you need to have a national release center. Initially, the CBHI, that's the Central Bureau of Health Intelligence, was given that job. But since they are not very specialized in it, currently CDAC Pune, they have been given the temporary job of being the national release center for SNOMED City. And so we had actually intense interactions with these people. 4 persons had come from IHT-SDO, and we had intense interactions on August 26th, 27th, and 28th. 26th was a general interaction where I think Dr. Karanveer Singh was also there. 27, that was a very intense interaction among the NRC members, the ministry officials, and IHT-SDO officials. And 28, there was a meeting in the ministry itself regarding the way ahead, and we have really made good progress. So once this authority is set up, the National E-Health Authority, that is again likely to become the National Release Center for SNOMED City. So lots of things are happening, lots of things maybe in parallel, but likely to converge. Then earlier what was the National Rural Health Mission, then added with the Urban Health Mission, now it's called a National Health Mission. That has got an ambitious national helpline program. Now there's a toll-free number 104, but that was supposed to be built up as a private-public partnership by the state governments. And only 7 states, including Andhra Pradesh, which is actually having one of the best services in that, have made it functional. The 8th state, Bihar, has floated the request for proposal. So you can see we are far away from what we wanted. So there is a process going on right now. There's a thought of making it a national helpline, maybe 1800, and wherever it's available through the 104 state lines, that's going to be, and the National Health Portal will actually be coordinating it. So we are about to float an expression of interest for that. So these are some of the activities where National Health Portal is directly involved, as well as some of the activities which I believe will become a very important part of the health or e-health component of the digital India that the Prime Minister is planning. Thank you.